Madam Speaker, question 46, 2015, under my name, is directed to the Minister for Health. Can the Minister inform this House what is the current Ministry's doctor-patient ratio and its breakdown? In the next 5 years, what percentage ratio is he looking at? Thank you.
Thank you. Honourable Minister.
Madam Speaker, I thank the Honourable Dr. Neil Sharma for his question. Currently in Fiji, within the Ministry of Health, we have around 510 doctors. So the current ratio between doctors and the population is 1 doctor per 1,600 population. If we take into account the number of doctors that are working in private practice, that stands at around 200 doctors. So if we take the combined number, the ratio would then drop to 1 doctor for 1,200 population. The standard by the World Health Organization for an acceptable, efficient health service is 1 doctor to 1,000 population. And that is also the target of the Ministry of Health, to bring the ratio of doctors down to 1 doctor to 1,000 population. Over the past few years, my predecessor was very instrumental in doing this. The government has already agreed to have a new establishment of 150 doctors every year from 2014 to 2017. So for these next few years, we'll be increasing the establishment of doctor positions in the Ministry of Health. This will cater for our new graduates from our 2 schools, namely the Fijian National University and the University of Fiji, and also graduates from other overseas organizations, institutions. The first batch of University of Fiji doctors graduated in 2013, and this has increased the number of interns that we have up to 75 in 2014. That's the first time we had such a large number of interns. It used to be around 20 to 30. This year, we've expected 79 interns from the 2 universities, although we only have about 70 in place because 9 had to go back and complete their internship programs. We believe that if the number of new doctors entering the population of doctors and the attrition rate does not change, we should be able to meet the target of 1 doctor to 1,000 population by the year 2017. Thank you, Madam Speaker.
Thank you.
Madam Speaker,
question.
I'd like to ask the Honourable Minister for Health if that doctor ratio includes the nurse practitioners who also work as doctors in medical facilities. Thank you.
Thank you, Honourable Minister.
Madam Speaker, I cannot confirm whether that includes the nurse practitioners. I will need to clarify that, but I assume at the moment that the figures given to me relate to the doctors themselves. Yeah.
Thank you.
So it does not include the nurse practitioners. Nurse practitioners will be included in the number of nurses.
Thank you. The Honourable Karawaki, you are allowed only 1 supplementary question.
Thank you, Madam Speaker. Supplementary question. If the Honourable Minister for Health, Madam Speaker, can confirm to this House whether those doctors that are expected to come into the workforce, as stated, whether there is a guarantee that they will actually join the workforce, or there are factors that might not eventuate as according to what they're expecting. Thank you, Madam Speaker.
Thank you. Honourable Minister.
Madam Speaker, I'm not sure what the question is. If perhaps the Honourable Member could elucidate a bit more what sort of factors he's referring to.
Please, Honourable Karawaki.
If I can be given time to explain the background of my question. In the past, and I understand that it is also now, it is not easy to retain doctors because doctors are living. They find where there are opportunities, they go there. Now, the Honourable Minister has explained that they are expecting doctors to complete their studies and to join the workforce. And I'm asking the Honourable Minister to confirm whether that will actually happen, those numbers that they are expecting to join the workforce will actually join the workforce. Or there are expectations that they might not. And what are the remedies that they have in order to achieve what they're expecting to achieve? Is the standard of 1 doctor to 1,000 according to the population. Thank you, Madam Speaker.
Thank you. Honourable Minister.
I thank the honourable member for his question. There is no doubt in my mind that the purpose that we develop doctors is to make sure that they can provide the services in Fiji. So the doctors that we're talking about here are the young doctors, the new ones that are coming out with their initial degrees. Most of these doctors, when they come out of their training programs, they look forward to being employed in the Ministry of Health. We assign them responsibilities in the Ministry of Health. And there's, I think one of the questions that has been raised by the honourable member is relating to the retention of doctors. And we understand that there are a lot of factors that affect retention, factors such as remuneration, factors such as the opportunities for further career development, the structures and the availability of positions within the workforce. These are some of the things that we're looking at now, and it will also be a part of the program that we're working with the World Bank in terms of the overall reform of the civil service, to structure the medical fraternity in such a way that it encourages doctors to stay. It is not going to be something easy because, you know, once doctors become specialists, the amount of money that they can command in other countries is far higher than what we can offer here in Fiji. But we look to be able to create a culture in the ministry and structures that encourage them to have career paths, to enhance their learning, and at the same time try to keep them in the country. That is something that the ministry will be focusing on.
Thank you, Honourable Minister. I therefore give the last question to the Honourable Balabo.
Honourable Minister for his reply. And on the issue of this doctor-patient ratio and on the issue of private doctors, can the Minister explain as to what sort of, is there a policy in place where private doctors, I mean, it's mandatory on private doctors to spend some hours in the nearest public hospital so as to cushion the impact of a shortage of doctors? Thank you.
Thank you.
Madam Speaker.
Honourable Minister.
Madam Speaker, there is no such policy in place, though where there are shortages, the Ministry of Health sometimes invites doctors in on locum, where they spend a few hours and they can help out in the health centres. We also have a provision where all the doctors in the Ministry of Health who are not involved, for instance, people at the positions of Deputy Secretary Directors, they are also required to give around 4 hours of their time to provide clinical services in our various health centres and doctors. So there is no policy as such, but what we do, where there is a need, we invite them or we take them on as locum to provide services within our health centres and our hospitals.